Hello and welcome. This video outlines what has been a great year for the South Warwick NHS Foundation Trust. 2015-16 was our busiest year ever. We saw more patients than ever, and in what has been an extremely challenging year for the NHS, our trust made a surplus of almost £250,000. Our success isn't due to good luck. It's due to the phenomenal hard work of everyone who works for the Trust. And on behalf of the Board of Directors and the Council of Governors, I want to thank everyone involved with the Trust, whether it's as an employee or whether as a volunteer. Without your hard work and efforts and commitment, the South Warwickshire NHS Foundation Trust wouldn't be the great success it is. Thank you.
Reflecting back on another really positive year in the Trust, I'm standing here in our A&E department. One of the things that we did particularly well last year was delivered against the 4-hour standard, and that wasn't just about what happens in A&E itself, it's what happens in the hospital with effective flow, but also flow across our whole system, including our community services and our local GPs. We delivered that standard throughout the year, but we also were able to move forward on a number of other exciting developments which you'll hear about throughout this video.
It's been a bumper year for South Warwickshire Foundation Trust, where we have reinvested more money than ever in improving patient services. We've invested over £19 million this year in a whole wide range of schemes. Some of those have been about essential maintenance and just about keeping the show on the road. Some of those have been about buying new cutting-edge technology and equipment for our clinical services. And some of those have been about new facilities for existing services, such as our dermatology day unit, which is a fabulous new facility for our dermatology services. But the majority of our money has gone into two very big schemes that have been about building for the future. The new hospital at Stratford is being built and is up and out of the ground. We've already built the car park and the energy centre, and this time next year we'll be in there providing clinical services for patients locally at Stratford. And there's the new ward block where I'm standing today, a new facility for our orthopaedic services. Again, a facility to match the excellent services we provide, was opened before Christmas. And part of that facility was about building a new suite, this Beecham suite, which provides patients with an opportunity to pay for enhanced facility while they're in here having their NHS care. The money that we make from that gets reinvested back into future capital programmes and will help us deliver the continued investment in patient services.
The Trust received just under £250 million in income for the financial year 2015-16. The bulk of this, 66%, was spent on pay, as we are predominantly a service provider. Overall, the Trust delivered a financial surplus of £244,000, which, although small relative to our income, is a significant achievement. We are one of very few providers who have delivered a financial surplus in this financial year. We also delivered on our cost improvement programme, and we work very hard with clinical engagement to ensure that we deliver these cost efficiencies. And over the last few years, we have consistently been below the national average, which demonstrates that we are an efficient provider. We will continue to work on our clinical engagement to deliver savings and a financial surplus into the new financial year.
Hi, my name's Chantal. I'm one of the community nurses working in the Stratford District Nursing Team. I'm also a staff governor. This role involves me taking views from patients' door and from staff to the Governor's Board. We've had a very busy and exciting year in the Stratford District Nursing Team. We've had a new manager and we've moved offices, so we're now back in the town, which means we have a lot less travelling time and spend more quality time with patients. It's always been a challenge to get around Stratford, being a small and very busy town. This can get even worse on busy events and days such as Shakespeare's 400th birthday. We made the decision that a couple of us would get on our bikes so we could see patients in a timely and efficient manner and not get stuck in all the traffic. This was a lot of fun, but it did take a lot of planning with the team leads, the matron, our manager, and I think the most important thing we do is working well as a team, and we will continue to do so in the coming year.
Hello, I'm Charles Ashton. I'm the Medical Director of the Trust, and I wanted to say a big thank you to all the staff for making this such a great place to work and a great place to be treated as a patient. And it's not just me saying that. There's a wealth of independent information that supports that view. If you look at the staff survey, we're one of the best performing trusts in the country. In terms of our targets and our outcomes, we're also doing extremely well. And this is validated by information from the independent benchmarking company CHKS, where we won a 40 Top Hospital Award. Our feedback on NHS choices is excellent, and clearly patients appreciate the care we give them. All of this, I think, adds up to a really great year for the Trust and great input from the staff. And it bodes well for next year, so we can go on providing safe, compassionate, effective care and do what we all get up in the morning to do, look after our patients. Thank you.